Hello, everybody. Welcome to our medical talk. Today, we're talking about liver cirrhosis, and our doctor of choice in today's interview is Professor Mertens. Professor Mertens, welcome. Thank you for taking the time.
Thank you, Peter.
We would like to jump right into it. And one of the questions that we hear quite frequently is, what are the first signs of a liver cirrhosis? Can you help us with that?
Most of the time, people will come to us because they show elevated liver values. So many times, the first finding really is something in the lab, not something that you feel, not something that you see, but most of the time, it's a lab value that raises attention. Usually, that is then the starting point of doing more tests and trying to figure out why is a liver value elevated, why are certain lab values out of range, and that again leads then to the diagnosis. If you have patients who have been very pain-free, you may very rarely find someone who really has signs of liver cirrhosis already, when you see the patient, not when you see the lab values. But that is a rare occasion. What you may find then is sometimes that people suddenly turn yellow. People may suddenly develop a huge abdomen. People may notice that they're bleeding more than they are used to. But again, these are signs that are usually signs of an advanced liver disease, and usually something that you don't want to see, but rather see earlier in a lab value.
Okay, but if at the beginning of a liver cirrhosis, you don't really have pain, you don't see anything, it's really the lab values, right?
It's really the lab values, yeah.
Okay. So then my next question that I prepared would be the first signs, but that's obviously
so
redundant. You have to do the lab.
You have to do the lab. I would still say, if you're not someone who's doing lab values in terms of checkups on a regular basis, then if you, obviously liver is in the right upper quadrant. Sometimes patients will come and will tell, I've had this pain, I have this pressure here. I feel more fatigued, so I'm more tired than I usually am. I have, people have told me that I have yellow eyes. Again, this is something that usually patients, most of the time, that patients don't see it themselves, but someone is coming and saying, you look like you have yellow eyes. So if any of those signs, from the less specific of, I have pain in my right upper quadrant, to the more specific signs for liver disease, again, yellow eyes, changes in blood coagulation, certain tendency to bleed longer. These are very clearly all signs that need to be checked by someone professional.
And what are the main causes for the liver cirrhosis?
So I think it's quite important to understand the concept that liver cirrhosis is an almost universal reaction of the liver to any form of damage. If you think of the liver as a very smooth, very shiny, very, very highly organized organ, if you keep damaging this organ, whichever way, this will over time lead to the forming of scars in this originally very smooth tissue. And the scar formation is basically a gradual process that in the end, when basically the whole liver is full of scars, is then called cirrhosis. So it's a process that takes time. And again, it's a process that basically is triggered by constant ongoing damage to the liver. So now when you come to the question, what are potential damages to the liver? Very important, viral hepatitis, hepatitis B, hepatitis C are very, very, worldwide triggers and damaging factors for the liver. Nutrition, we see more and more fatty liver disease. And people may not be aware of this because this is not necessarily someone who is obese. We do see fatty liver in obese people. frequently, but we do also see fatty liver disease in people who are very slim. So it's not like if you're not obese, fatty liver is out of the question.
Okay.
And then obviously other damaging agents, alcohol. Many countries, alcohol has always been the leading cause. And then there are more rare diseases, sometimes genetic diseases, so-called storage diseases, where the liver will, basically unphysiologically or in a damaging way store certain metabolites. This can be iron, this can be certain other types of metabolites, but this is, in general, it's viral hepatitis, nutrition and fat, alcohol, and then the more rare causes of genetic liver diseases.
Last question, because we don't want these interviews to be too long. Can the liver heal?
Yes, the liver can heal.
How?
One of the very fantastic capabilities of the liver is that liver heals really well.
Okay.
And liver heals to a degree that, just a couple of years ago, we were not aware of the fact how enormous the capacity of healing is. So I have personally had patients who've had full-blown liver cirrhosis, end-stage liver cirrhosis, if you want. And for example, that was triggered by a viral hepatitis C infection. And then if you treated the hepatitis C, you could really observe that patients would revert liver cirrhosis to a very low degree of liver scarring. So liver, if you take away the damaging agent, and this be a viral hepatitis, this be the fat in the liver, this be the alcohol or other damaging factors, as we've mentioned, the liver will, in many, many cases, go and basically repair itself. I'm not saying back to normal, but almost normal.
But it needs treatment and surveillance, basically,
It
or is it
needs-
still a lifestyle change and then it's all good?
It needs close surveillance because liver cirrhosis not only comes with the problem of the liver, failing its function, but also comes with a substantial risk of liver cancer development. So that's one of the reasons why we want to see these patients on a very regular basis. And it's really something that needs to be closely monitored because it's not a given. It's not that if you take away the alcohol, then the liver is for sure going to heal.
Okay.
But there is a good chance that it will.
Okay. Well, thank you, Professor Mertens. I know you have a very busy schedule as always. And I would like to thank you for being with us and helping us understand the whole concept of how you can treat liver cirrhosis. Thank you very much.
Thank you, Peter. It's been great. Thanks.